Welcome to Straightforward Conversation with Gary Hunter. My guest this evening is Reggie Robinson, the high-risk youth prevention specialist for Health Recovery Services. Reggie is a community coordinator for Health Recovery Services, and he's responsible for the development of a community education program, prevention and intervention, with 10 school districts and over 6-county area. He's a frequent speaker on a variety of substance abuse-related topics. Reggie has a certificate in chemical dependency counseling, and he has studied at both Shawnee State University and Ohio University. Welcome, Reggie.
Thank you for having me.
Tonight we're going to be talking about drug/alcohol abuse prevention and treatment within Athens County. Reggie, I'd like to start off tonight's discussion by just asking you generally, is there an alcohol/substance abuse problem among adolescents in Athens County?
Yes, there's a tremendous problem in the country in general, and of course in the state of Ohio and regionally. Just to give you some perspective, the average age of first use of alcohol in this country is anywhere from 10 to 12 years old.
Wow.
And there's actually documented, as of 1994, the state of Ohio treated 2 6-year-olds for alcoholism. There's a documented case also of an 8-year-old girl in Chicago, Illinois, who was treated for cirrhosis of the liver that was induced by alcohol abuse. So there's a tremendous problem, and it seems that the age of first use is getting lower and lower every year. In 1992, the Athens Hocking Vinton 317 Board, that's the Board of Alcohol, Drug Addiction, and Mental Health Services, which is a partial funder of our agency, and they fund other community care type of programs. They conducted a high school survey in 1992. And what they did was they took national statistics and they compared them to the statistics that we see locally in our young people of high school age. And they found some pretty shocking differences. For instance, nationally, according to the National Institute on Drug Abuse, there were about 25% of high school students who responded positively that they had used drugs within the past year. Locally, in Athens, Hocking, and Vinton, the number was 47%.
Boy.
Which was
Very high.
Nearly twice the figures. For young people who have used alcohol ever, nationally, the statistics were 46.4%, and in Athens, Hocking, and Vinton, it was 78.1%. For students currently drinking heavily, nationally it was 33%. In Athens, Hocking, Vinton counties, it was 35%. Marijuana use, nationally 13%, locally 30%. So you can kind of see the trend here. And we believe there are a lot of reasons why rural young people are especially prone to alcohol and other drug abuse. And we're very glad that our programming at Health Recovery Services takes their special needs into account and kind of the special nature of rural young people into account.
What is Health Recovery Services? I'm familiar that it's a nonprofit organization, but tell me a little bit more about what it is.
Well, we are very experienced in the field of alcohol and other drug abuse. Health Recovery Services recently celebrated its 20th year of serving Southeast Ohio, and we're currently organized into 4 divisions. We have a division of outpatient services serving our 5 counties, Athens, Hocking, Vinton, Meigs, and Washington counties. And at our division of outpatient services, we provide group and individual counseling to not only people with their own substance abuse problems, but also to their family members and significant others. As I'm sure you know, substance abuse is a family problem, and we believe in counseling the entire family unit. At our division of outpatient services, we provide group and individual counseling, and we provide it regardless of ability or inability to pay. There's a sliding fee scale. Major insurance covers the services, and of course we accept Medicaid. The second division is our division of mental health services, which is fairly new for us. Now, in Washington County, we provide comprehensive mental health services for children, adolescents, and adults. And in our other 4 counties, we provide mental health services for those who have a mental health problem as well as a substance abuse problem. They're called SAMI, or Substance Abuse and Mentally Ill Clients, and we provide a range of services to them, including crisis care and respite care and also outpatient treatment. Third division is our division of community services. We provide prevention, education, and intervention programs You may have heard of our driver intervention program for impaired drivers, people who are convicted of a DUI offense. That's a 72-hour state-certified program to help them avoid ever having another DUI, and to do an assessment and some counseling with them. We also have an intervention program for young people, the Youth Intervention Program, which is an assessment that's provided free of charge to area young people. They can be referred by parents, by the schools, by anyone, in short, who's concerned about a young person and thinks they may be abusing alcohol or other drugs. We have our program for Ohio University students primarily, called SAMCO, which is done in conjunction with the Athens County Municipal Court and also Ohio University judiciaries. And then we have a wide range of prevention education services. We have a speakers bureau. We have a women's outreach program that actually tries to reach women who have been sort of isolated and who are in need of outreach services, education. We have a newsletter that's sent out to them, and et cetera. We have also our prevention services go all the way from Head Start age. We actually have a puppet show that we do with them up to senior citizens and everywhere in between. We even have a service that we provide where we can go out to schools and other community functions, and we can provide a drug-free dance done by a drug-free DJ named Rockin' Reggie. I wonder who
no
that
relation.
is. So we basically, anything we can do to get the message out there about the dangers of alcohol and other drug abuse, we do there. And then, of course, the last division is our division of residential services, of which Bassett House is a part.
Well, stay tuned. Reggie and I are going to return after this commercial break. When we return, we're going to talk about Bassett House, and, which is a residential care facility for adolescents. Welcome back to Straightforward Conversation. My guest this evening is Reggie Robinson of Health Recovery Services. Reggie, before the break I was about to ask you about Bassett House, which I believe is the residential care facility portion of Health Recovery Services. So, could you tell us something about Bassett House, what it is, how many beds it has, etc.?
Certainly. Well, we have two residential care facilities, and a lot of people don't know about our other facility. And if I could briefly like to tell you about our Rural Women's Recovery Program, which is a program, residential program for adult women ages 18 and over who are chemically dependent. It's one of the innovative programs in the country, doing a lot of really good things there. It's currently in its 5th year of operation. One of the innovations there is that we have child care at the facility for children ages 5 and under. They can actually stay in treatment. They have their own separate treatment track, but while their mothers are in treatment, sometimes for months at a time. It's a variable length of stay, but some of the women are there for 4 months or so at a time. They can actually have their children in treatment with them.
Is this a voluntary admission program? Or
yes, it is. And actually there's a waiting list. There are a lot of women who want to take advantage of that program and can't find these particular services anywhere else. And again, we do a lot of innovative things there. We have a very high success rate and a lot of an array of services available to the woman in that program. So that's the Rural Women's Recovery Program. And then, of course, Bassett House is an adolescent inpatient treatment center. We accept adolescents ages 13 to 18, and we get them primarily from the Ohio area, from our 5 counties that we serve, but also from all around the state, and we even get some out-of-state clients. We've had clients from as far away as Canada, actually, and we're not sure how they heard about us up there. Bassett House has been in operation since 1980, and it was extensively renovated. Actually, we've got basically a brand new facility as of 1990 that's up to all the codes and standards, including the Americans with Disabilities Act. We're certified by all the proper accrediting bodies, including the Joint Commission on Accreditation of Healthcare Organizations, which is the most stringent certification body. We're certified by the Ohio Department of Mental Health, the Ohio Department of Alcohol and Drug Addiction Services to provide the services that we provide there. We have 16 beds, and we're a co-ed facility with a variable length of stay. meaning that the stay is tailored to the individual client to best meet their needs.
Now, is that a voluntary admission facility?
It depends on your definition of voluntary. Generally, the adolescents that we see at Bassett House aren't the first ones to recognize their condition. There's something we're dealing with called denial, and that means for the basic alcohol and drug addict, they're the last ones to see that they're in trouble with their use of alcohol and drugs, and most of the time they're very invested with continuing to use. And so anything that threatens that, they tend to not want to take a look at it. So the adolescents who are referred to Bassett House are usually referred by someone else, a parent, by the court, or what have you. And they may not be specifically forced to go to Bassett House, but it may be a choice between going to Bassett House or going to a juvenile detention facility. And in that case, they make the choice to go to Bassett House, and we consider that voluntary. And actually, the leverage tends to help in them buying into the treatment program and being compliant with the treatment program long enough for the education to sort of sink in and for them to start to realize that, yes, maybe I do have an alcohol drug problem. Maybe there's something I need to do about it.
If I were a parent concerned about my son or daughter that was between 13 and 18 may possibly have an alcohol problem, what would you tell me are the signs that I should be looking for that would be symptomatic of generally symptomatic of a person that's beginning alcoholism?
Mm-hmm. Well, and I'm very careful with talking with parents. I do a lot of parent education. I'm very careful not to try to make them diagnosticians. This is a professional field, and it takes many years of training to really diagnose substance abuse chemical dependency. However, I do say this: parents are blessed with something unique that I call parental radar. And it seems that the mothers have it in higher dosages than we fathers do. And what I mean by that is that they have, red flags that go off for them. I know that my mom, she usually knew when I was up to no good 2 weeks before I did. And she might not have known what was happening, but she knew something was going on funny. And I urge parents, if your radar is going off and you think something funny is going on with your kid, chances are it is. And that's the time when you first notice that. That's the time to start checking into it. Some of the usual signs that we see are a change in attitude. I mean, a real pervasive change in attitude. Someone who didn't talk much or what have you now all of a sudden is talking a lot, or someone who talked a lot gets very, very quiet, sullen, and withdrawn. Change in eating habits, change in sleeping habits, some of the pretty traditional things that we're taught to look out for. Drop in school attendance, a drop in grades, problems with behavior at school. There are a lot of things, and actually for parents, we have some information that we can give them. We have a booklet that we produced. I should have brought a copy with me. It's called Parenting for Prevention. Talks about some of the warning signs, talks about the drugs that are commonly in use, what they look like, what some of the dangers of them are, and what some of the symptoms are of those drugs. And they can pick that up at our office at 28 West Stimson Avenue at no charge.
I'm assuming you classify alcohol as a drug.
We certainly do.
What other signs would there be different for other substance abuse drugs that children might be in, marijuana, etc.?
One of the ones that we're most concerned about, and actually the fastest rising category of drug abuse in the country, is inhalants. And parents are routinely pretty shocked when I tell them that their young people may be getting high just by going through their cleaning cabinets. And I'm not going to talk about the specific inhalants because young people may be watching, but parents would do well to be educated about these. I remember one parent in particular that I talked to, and she noticed some behavioral changes in her son, and she really couldn't get to the bottom of it, and we kind of eliminated things one by one, and we came to find out that actually her son was huffing, and that's a term that means using inhalants, and he was actually huffing something that he got from the top of her dresser in her bedroom, and she would never suspect that you could use that to get high. So There are. I'm kind of losing track. What was the question that you asked?
Well, I was asking you what the other drugs were and what symptomatology might flow from those. That leads me to a question that now, as a parent, I have a strong suspicion that my son or daughter is using either alcohol or another substance to excess. And I've contacted you, and you may concur or be strongly suspicious. How are we going to get help for my son or daughter who is in the stage of denial or is not admitting that he or she has a problem?
Well, the first thing that we would do once we get the call, and I've done this many, many times, is that we would try to find out what the nature of the problem is, how far along it is, and we would recommend further action, further assessment, or what have you. We have a program which is, again, one of our most long-standing programs called the Youth Intervention Program. And I mentioned it briefly earlier. Parents can refer into that program. It's provided free of charge, again, through the Athens Hocking Vinton 317 board. So that's a day-long program. It takes place on a Saturday. And we have a staff of professional counselors who do a raw assessment at that point and kind of try to get a handle on what's the nature of the problem, how far along is it. They make a recommendation from there, and based on that recommendation, that young person may then go into outpatient treatment and get a full-fledged, what we call a biopsychosocial assessment. Assesses them in every area of their life. And from that, there's a recommendation made, depending on how the severity of the problem. It may be outpatient counseling, it may be intensive outpatient, and the recommendation may be, in a very, very extreme case, for inpatient treatment.
What if I call you up and say, Reggie, I'm really concerned about my son or daughter. I have a strong suspicion, but I'm also very concerned that if I try to force the hand at this point, that he or she will never have anything to do with me again. How do you address my concern?
I would say that that's a very valid concern, and it's one that we've addressed before. And unfortunately, there's no easy way around that. You may be dealing with a very angry young person who gets forced into treatment, and what I urge parents to do is basically to weigh that. You may have an angry young person, an angry alive young person on the one hand, or you may have a very dead young person on the other hand if nothing is done, or nothing is done in time. I've been in the field of alcohol, drug abuse treatment and education and prevention for the past 10 years. Unfortunately, that's long enough that I have seen young people die from this disease, and it's a tragedy. And the real tragedy of it is that we have effective treatment, and it works. The thing is that a lot of young people just don't get treatment, or they don't get treatment in time. And I don't want to see that happen ever again. We lose one young person, that's one too many.
Stay tuned. Reggie and I will return after this commercial break. When we return, Reggie and I are going to talk about what happens once the adolescent is at Bassett House, what kind of treatment they get. Welcome back to Straightforward Conversation. Tonight I'm talking with Reggie Robinson of Health Recovery Services. Reggie, before the break I was about to ask you what happens to an adolescent once they arrive at Bassett House. We've determined they need treatment. We've determined they're going to be a residential patient at Bassett House. What will happen to that adolescent?
Well, there are two phases of treatment at Bassett House. Again, it's a variable length of stay program. The stay is tailored to the individual's needs. They may be short-term at Bassett, they may be long-term. And during the first phase of treatment, the client comes in and they're in an intake phase. We do a complete biopsychosocial workup. We basically find out everything about the client. They're not in the general population yet, so they get to sort of bond with the counselors at Bassett House and with their case manager. And we find out everything about them, including what's their favorite meal. And sometime before they leave Bassett House, we
get their favorite meal.
Yeah, we serve their favorite meal. We do the biopsychosocial assessment. We tailor the course of treatment for them, and then they're mainstreamed into the general population at Bassett House. Once they go into the general population, they receive we have a wide range of services at Bassett House. We have a complete nursing unit. We have a medical director who is there on site, on duty. We have medication is dispensed to the clients. If they're on medication, we can continue that or adjust it as necessary. We have an on-site school that's actually supervised by the Athens School District and also by the Alexander School District. They provide services. We have a certified teacher and co-teacher at our school. And the school...
So they're not permitted to go to the local school?
No, and actually the school program is really tailored to their specific needs. Some of the kids have had problems with school. Some of them may not have been in traditional school for a while, so we try to build in success. We meet them at their level rather than setting some
failure
level. Yeah, right. We build in success to our school program, and we emphasize life skills. So we will try to give them the skills to fill out a job application, to come up with a resume, and what have you. We have, of course, individual and group counseling. All of our counselors are certified and bachelor's level. We have a lot of bachelor's level or better. We have a lot of master's level people, and we have case managers, all of whom are certified licensed social workers, and a lot of them have master's level degrees as well.
Does the adolescent go cold turkey? Does he receive no alcohol, no drugs while he's there, or do you wean them off over a period of time?
No, we have a totally alcohol and drug-free environment. Now, for some adolescents who may be in danger of physical withdrawal from the alcohol and drugs that they were using, we medically and safely withdraw them. That may require dispensing some medication to them during the intensive phase of the withdrawal, and then kind of decreasing the medication as they physically get better. But most of the adolescents, their bodies are young and strong, and they pretty quickly withdraw from the drugs without acute side effects from the withdrawal.
We've heard people say a long time that once you're an alcoholic as an adult, it's a continual battle the rest of your life. Is that the same with an adolescent?
Yes. Unfortunately, it's a lifetime disease. It's a chronic disease, and it's one that has a very high rate of relapse. And that's one of the reasons why at Bassett House we've been continually working on ways to not just have Bassett House be the final experience for these adolescents, to have something to follow them up with later, and to kind of keep them involved in the continuum of care.
Well, Reggie, we have only about a couple minutes left, and I know you mentioned to me before the program started that you have a new program, a community-based intervention outpatient program. Could you kind of summarize what this new program is and what its services are for the public?
Yes. Bill Kuhn, the site manager at Bassett House, is the originator of this program, and we're really excited about it. It's really an innovation that I've not seen in another treatment program anywhere. And the community-based intensive outpatient program is run in conjunction with the Clear Creek Valley Therapeutic Foster Care Homes. Basically, we can follow a young person with our services up to the age of emancipation. It's a multi-level program, a 5-level program that actually can provide intensive outpatient services, case management, and all the way up to the age of 18.
Well, thank you, Reggie. This has been a very interesting topic, and we may have you back another time in more depth. This has been Straightforward Conversation, and thank you and good evening.